The outline of our presentation is Brian is going to take us through an overview of our secure healthcare analytics and research platform, followed by I will be going through the CMS requirements for enhanced federal funding, the 7 conditions and standards, which will result in 90% funding for DDI periods and 75% federal match for operations of federally certified decision support systems for the Medicaid program. Then I'm going to touch on the Medicaid innovation and transformation that is occurring in New York State, that the Medicaid data warehouse and its sister set of systems, which we're going to speak about, are critical to these fast-moving implementations and innovation and changes in the program that are occurring. I've had the pleasure of working with Brian for about 15 years. The OHIP Data Mart was our sort of first child together, and it has grown greatly, as you will see on some of the slides. And I've had the pleasure of working with him on the Medicaid data warehouse implementation. As mentioned in his bios, he is a nationally recognized authority on Medicaid data warehousing. He is a recruited feature speaker at some of the largest annual technology conferences that are held for very well-known vendors in this space. So it's my pleasure to introduce Brian Dougherty. Thank you.
Thanks, Joe. It's great to be here. I'll try to stay next to the mic. Maybe the first thing we should do is talk a little bit about when we use the term accelerator, really what we mean. So there are really two key aspects to the accelerator concept. One is 2 purposes. One is to reduce delivery time. So think about building a very large data warehouse with hundreds of servers, petabytes of storage, many different constituents, many different agencies, external agencies, internal agencies that need the data, secure environment, and starting from scratch and coming in and doing that. There's a lot of risk in that. So the second purpose of this accelerator concept for us that we've kind of evolved over the last 15 years is to reduce risk. So accelerate delivery for large projects and reduce risk. And what we've done is taken a set of accelerators at kind of what we would call the service layer, the technology services layer, and software and hardware. We've bundled them into a set of reusable components, and we use those reusable components, again, to accelerate the delivery and reduce risk for the projects that we deliver. So what are some of those accelerators? Security. We have a runtime security framework. That's a crucial aspect of delivering, as we all know, any technology today, especially in the healthcare field. User provisioning and access management. When we have thousands of users that are using this warehouse, it's no trivial aspect to be able to provision those users and to get them up to speed, and to also keep track of what they can see and what they can't see. So that's a key piece. Integrated consumer portal or customer portal. So we work on the premise of a single entry point into the warehouse. So when we say warehouse, it's not really one discrete object here. We actually have many platforms that we deliver. So when a user sits down and starts to use our warehouse, we really want one pane of glass, one single view into the warehouse that kind of simplifies their navigation. An analytics and reporting framework, which I'll talk about. Something called DW Assistant or Data Warehouse Assistant that I'll talk about. And metadata is important. We need enough metadata to provide context to the data that we deliver, but we don't want to spend kind of all of our time and effort on metadata. So metadata is a term that's gotten a lot of publicity over the last 20 years. It certainly is important, but we kind of need to keep it in the proper context. So metadata is a key part of our accelerators also. And then finally, on the back end, in New York State, we take in thousands and thousands of files weekly, and we have many different streams that run simultaneously. So this extract, transformation, and load, think about this as kind of a wholesaler of data. We take data in from all over the place, we integrate it, we homogenize it, and then we publish it all over the place. So we're really just a kind of a big wholesaler of data. We take it in and we push it out, either through our own analytics content or we publish it externally. And so we built some accelerators to help us with this control of the coherency of all the data that's coming through. And we have something we call the event broker, which is kind of a traffic cop on steroids that kind of has all this metadata and rules that help us kind of orchestrate all the data. And then finally, we have this secure data exchange framework, and we have 2 products that we have that we'll talk about at the end. Okay. What about the security? So really, for the New York State data warehouse, again, it's not, don't think of one large kind of computer or one single piece of software. There's really 6 cooperative platforms that we build, and they all work together. So in each of these platforms, when you register someone into the warehouse, again, we have thousands of users, the first question is, which of these platforms does this user have to use? What can they see? What can't they see? Down to the column level, and kind of register them into this integrated warehouse. And then when someone logs in at runtime, have all of your information, all your context data follow you around wherever you go within the warehouse. So that no matter how you come in, what product you're using in the warehouse, it's the same secure security context that follows you around. So some of the cooperative platforms where we have actually integrated and implemented this framework is in the web portal environment. So we have single sign-on. So we have a business intelligence platform that has a suite of products. Ad hoc query products, reporting products, all kinds of analytic products. And when you log into the warehouse portal, you actually, when you transition to all of these products, you don't have to re-log into the product. So if you have your favorite 5 products in our BI stack, you log in once, and then behind the scenes, we make sure that you just have the authorization to get into the product that you need. Business intelligence, we have many different products, and again, that's all integrated through this single sign-on. The metadata set of products, all single sign-on. You sign on, you set the context, we know what you can see within this environment. Something we call data delivery, which we'll talk a little bit more about, our ETL platforms, and then finally all the databases that we have. So we have about 6 to 8 different databases that we stand up and that we publish to the outside world. For the provisioning access management, we spent a lot of time on this. It's essentially a workflow engine, and it's a very elaborate and comprehensive user provisioning set of software. So it's HIPAA and high-tech compliant. It takes into consideration gathering information about the user, not only for the data that they can see, but also training information, educational information. There's real-time alerts that go out to supervisors or to the individual. And again, it's an extensible workflow. So what that means is if something comes down the pipe and there's a new requirement for provisioning that comes down the road, we can plug that into this workflow and we'll very simply be able to pick that up. But essentially, it's about a 10 to 15 step process, depending on who you are, to provision this user. And once they're provisioned into this LDAP, we have everything we need for all the security. As I mentioned before, single sign-on is one of our key accelerators also. Again, it's a very simple idea, but it's important. We have one single pane into the warehouse. We have 8 different databases. We have a lot of different reporting query tools that we serve up. And you sign in once to the warehouse. We have that centralized LDAP, and then it follows you all over the place. So you don't have to sign on again and again. You don't have different security implementations for different products. It's just kind of a uniform implementation, and it's a very user-friendly experience. That's essentially what the intent of it is. If you look at our portal, another key aspect of this in the New York State Medicaid data warehouse is this idea of user personalization. So a lot of these accelerators, which are essentially software that are driven by metadata and tokens to kind of personalize it, is this concept of a personalized user experience. So when Joe sits down, Joe sees what he should see, and he doesn't see what he shouldn't see. When Sally sits down, she sees what she should see. We know who she is, and she doesn't see what she shouldn't see. So maybe one of them gets an ad hoc analysis environment, and we have OBIE as one of our tools that we serve up here. But if someone else comes in and they don't have access to that interactive ad hoc querying, they would not see that on their portal. On the left side, for the available reports, you only see the reports that are available and germane to you. And on the right-hand side, there's kind of a queuing environment. So you get to see all your reports that are currently executing. Some are in queue, maybe they're future reports that you set up for tomorrow. And then you also have all your history in your queue. So again, it's a personalized experience. You have your own personal queue. You only get presented what you need to get presented, and it really streamlines and simplifies the experience for the user. The problem with a large warehouse like this, when you have 10,000 tables, you have 8 different databases, you have a lot of BI content, is that if the normal person sitting down becomes overwhelmed by this jungle that's out there. So what we've tried to do is personalize the experience when the individual sits down. So it makes a big difference. Okay. We've also, another one of our accelerators that, again, we build software that we can't find on the market. So we had a couple other problems with the products 4 or 5 years ago that were on the market at the time with respect to ad hoc querying. There are a lot of, we have about 6 billion claims that are online and active right now. And we have thousands of users. So one of the things people like to do is they like to come in and they'll grab 100 million claims or something. And they'll bring it to another system, or they want to bring it down and do something with it on their desktop. And that's a problem. You know, it's not good to bring 1 billion rows down to your desktop. And they do that because they may have 80% of the data they need in the warehouse, but they never have all the data they need. They may have a subpopulation, they may have a cohort, they may have something on their desktop that they'd like to inject into the warehouse and then use that to kind of drive their querying. And we couldn't find a product that allowed us to dynamically inject data into our platform, stay up on the platform, and then for people to kind of have their own populations, their own SIN recipient set, their own provider set, their own diagnosis codes. So we've built this concept of my private data in the accelerators. So essentially what that means is that all the users, in addition to all the data that's built into the warehouse, we can store their own private data. To them, it looks like it's up on the platform, right with the rest of the warehouse that's there. So rather than going in and taking 1 billion rows down to their desktop and running it against their set of 10 SINs, or 1,000, or 10,000, we inject that up into the warehouse, we protect it security-wise, and it's only their private data. So it's like they get the whole warehouse and they only see their private data. The other person doesn't see my private data. I'm the only one who sees my private data, and I can use that to join into the warehouse itself. This is a portal environment that allows you to point and click, inject that up into the platform, and then use that for all your querying. Why don't you go to the next one? The other thing that we found that was missing that was very helpful is the concept of templates, user-defined templates. There's a lot of abstraction. There's a lot of common patterns for query and analysis that go on. And there really wasn't a great way for a lot of tools to kind of capture that abstraction and those sets of queries via templates. So what we've done is we've allowed people through this portal environment to kind of build their own templates and to store them up in the warehouse itself, and then reuse those and publish those to other query users that are there. So that's kind of a second major piece of this. And a third piece of this is the ability to register custom SQL. So we essentially have 3 types of users in the warehouse. We have power users, and those are actually users that can use their own desktop, connect to a database, and run all kinds of queries. They can write their own SQL. We have users that can run kind of reports and queries, and then we have executive users that dashboards, drill down, and things like that. So some people, though, are kind of people that want all the flexibility of writing your own SQL, but they're not comfortable writing it themselves. So what we've done is we've allowed them to register their own SQL so they can cut and paste from tools or products. And then, again, they can launch that, inject that up into the warehouse cloud, if you will, and then our software will parse it semantically, make sure it's good, and then they can just keep re-executing into their queue. So just think, a way to think of it is, if we build 100 reports and we publish these 100 reports, now we've given the ability for the user to extend those 100 reports for themselves by registering their own custom SQL. And then it gets launched into their queue, scheduled, download, protected, zipped, compressed, everything, it's all taken care of for them. So DW Assistant, Data Warehouse Assistant, has been a great success for us up there, and because it's really provided capabilities that we really couldn't find on the market with a lot of different tools that are out there. Just another view of this. Again, one of the issues we had is the New York State Medicaid, we have such a critical mass of data. We've integrated so many programs that are there, Medicare, Medicaid data, we just have data from all different agencies coming in, that a lot of these other agencies that are there need the Medicaid data, but the Medicaid data is not their only data. So really what they want to do is have us deliver them Medicaid data, and then they want to integrate that with their own data, mental health data, disabilities data, whatever, substance abuse data, whatever it is, on their own platforms. So what we become is just kind of a wholesaler of data. They're not running analytics on our platform. We're just serving them up data dynamically. So, you need a technology that makes it easy for people to request large amounts of data and then inject that into their own internal systems. And that's really what we've built here. Otherwise, you got to call up a programmer. You got to wait 3 weeks. You don't know what you're going to get. You made a mistake. Then you got to go back and wait another 6 weeks. So what we allow them to do is to register their request, and then we, through extreme compression, encryption, we deliver this very, very quickly to them. Okay. Integrated metadata reporting. We have a set of accelerators that allow us to kind of bring all the producers of metadata. We have a producer and a kind of a consumer framework of that, and push all of that metadata in one integrated repository. So the ETL produces metadata, the BI produces metadata, the database at runtime produces metadata, who's running queries, what are they running, what are they getting. So we kind of provide a facility to integrate all of that metadata into the portal also. Okay. Finally, there are 2 other products, accelerators and other products that we've put together, delivered. And most of these products are built either in Java-based products, or they have SQL components. They may have some PL SQL components for the Oracle platforms, but essentially it's Java-based accelerators that we produce and deliver. So any J2E framework that's out there, we can drop these in and they can run. So it's very quick to get these up and running. But there's two other pieces that we really had issues with, and one of it is when you build a large warehouse, you have many different nodes where data has to be moved point to point. Again, we take thousands of files in. We have many different data marts that are there, and we have many different external entities we distribute to. So we couldn't find on the market a set of software that allowed us to move this data fast enough in high volume. We process terabytes a night. We bring in terabytes a night. So we got 1,000 tables, and we got to move a terabyte in a night. So we built a product called Data Ingestion Suite. And Data Ingestion Suite is essentially a high-speed data transport with endpoint intelligence. That really just means that we can plug it into any source and we can move it to any target graphically. And we built the runtime framework, the engine for that. So Data Ingestion Suite was is a great product for us. And again, it's part of a key aspect of this services level. Okay. And then finally, we have this data delivery portal, and this is the last thing I'll say, and then Joe will come up, is essentially what it is it allows external consumers, agencies, entities, CMS, to put a subscription in to data through this portal and build a subscription. Think of 20 years ago, an extract. A whole bunch of COBOL programmers, Java programs write an extract. Every time you want a new information request, you got to have another extract. We've moved that to a publish and subscribe model. So all these consumers have to do is put a subscription in, and then we publish a set of kind of templates that we deliver data to, and they can automate a delivery of that data. And that's what we call data delivery. So just a brief introduction of some of our accelerators, and if anybody has any questions, we can talk about it afterwards if you like. So I'm going to bring Joe back up to the podium now.
Thank you, Brian. I'm sure folks are somewhat familiar with the CMS requirements for enhanced funding, the 7 conditions and standards that are now part of MIDA 3.0. And hopefully, based on Brian's presentation, as I step through these quickly, you will see it'll resonate with you how our SHARP solution satisfies these requirements. The first one is the modularity standard. Certainly the CMA technology accelerators are built on that concept. We use open interfaces and exposed APIs. Brian mentioned Java, XML, .NET, or other protocols we support. We have a proven component-based system development methodology that we implement in these large-scale data warehouses. For the MIDA condition, we're very confident that the SHARP solution will advance the MIDA maturity levels, especially in regard to the 7 condition and standards, and any state self-assessments and roadmaps that a state has to produce will be supported by a partner that has decades of Medicaid experience, both as a company and hundreds of years of experience individually. The third condition or standard is the industry standards condition. For the Medicaid data warehouse implementation, and I was the primary author for that RFP, we had a lot of security standards, HIPAA standards, Section 508 accessibility standards, NIST standards. The Medicaid data warehouse in New York goes through an annual security assessment performed by an independent company agreed upon by the state. All of these standards are incorporated day one. They're clearly defined at the requirement stage and carried through all phases of the implementation. Leverage condition, that's what SHARP is all about. So I think enough said there. Business condition, as Brian mentioned, the key is getting access to understandable, accurate, and timely data to be transformed into information to make decisions about the Medicaid program. To provide customer service, we have an enterprise help desk, again, with years of experience in the Medicaid program and assisting users in a data warehouse environment. There was a strict set of service level agreements incorporated into this engagement, and it's very strong performing, thoroughly tested implementation for New York State. The reporting condition, again, about accurate data. There's the scheduling capability within the ad hoc tool that's plugged in for your specific needs. The standard reporting, as you saw through that framework, has a scheduling and queuing capability also. There are multiple queues set up to service those requests for standards reports, and we service thousands of queries a week. Interoperability, we have about 13 state agencies and New York City Human Resources Administration as key customers. We exchange a lot of information with them. The TMSIS report for CMS has been transferred from the MMIS to the Medicaid data warehouse, and we're beginning to perform that function for the state of New York. Besides the 13 state agencies I mentioned before, CMS is an active user of our implementation, and also New York City and 57 upstate counties. I believe we have approximately 1,500 users of the system at this point. Also, as part of DISRIP, which will be on the next set of slides, there is a provider portal being developed to support that initiative. The next one are the 3 goals of the CMS certification, particularly for a DSS. There are 3 checklist items. you know, somewhat generic, but certainly we deliver on this and more. We provide a very understandable data model to users perfected for New York State that would be leveraged for another state's implementation. Timely and effective reports, again, and we support improved analysis. We think of our solution as sort of an iceberg effect. The users see the very tip of the iceberg. They see the query tools, the predictive analytics tools that are plugged into our solution, but there is that whole piece of the iceberg that lies below the surface, and that's what the Sharp solution provides, a solid foundation that through its SOA and modular capability and design, you can plug in the tools that are most appropriate for your clients. In terms of performance, here's a graph, weekly operational report. We have a set of operational reports we would also leverage for another state's implementation. 80% of OBIE queries, the ad hoc query tool we're utilizing for New York, they execute and deliver results in under 5 minutes. Very impressive given it is ad hoc queries. These are not predefined, optimized reports. These are users dragging and clicking, sometimes in the not most efficient manner, but delivering those results 80% of the time in 5 minutes, and often much, much less than that. As you can see, we're tracking at this time at 60% in under a minute out of that 80%. Okay, now I'd like to touch on the Medicaid innovation that's going on in New York State. I won't go into great detail because of time, and there is a wealth of information on these initiatives on the DOH public website. I would like to thank DOH and Greg Allen, who's the Director of Financial Planning and Policy, for some of this content. He is a nationally recognized thought leader regarding Medicaid innovation. DSRIP, the Delivery System Reform Incentive Payment Program. This is funded by $6.4 billion in federal savings that New York State achieved since January of 2011 through the Medicaid redesign team's work. And again, our systems played a critical role in these savings. The goal of this project is to reduce avoidable hospital use by 25% over 5 years. The 25 PPSs involved in this program. Hospitals are generally, I think, predominantly, if not exclusively, hospitals are the hub of these performing provider systems. There's a set of measures, baseline, using our systems that become projects that these PPSs submit and are granted access to implement. Our systems play a critical role, from the MDW to the Clinical Data Mart to the forthcoming Medicaid Analytics Performing Platform, the MAP platform and data warehouse. We're also doing the PPS network management tool and doing various attributions and project support activities. Time does not allow, but here is a representation of the MAP portal that we are implementing for New York State. Medicaid Health Homes Initiative, again, funded by savings, federal savings achieved through the Medicaid redesign team. The concept of Medicaid Health Homes is coordinated care management for super utilizers. And it supports CMS's triple aim of better individual care, better population health, and reduction of costs. It has its own specific criteria. The folks from Idaho, our previous presentation spoke about these types of initiatives and their specific criteria. New York State has their own. and some other very important programs that we have supported through our systems over the years. Some of this, bringing more cost savings that can be redirected elsewhere, like the MRT cost savings were. Medicaid drug rebates at a time over the course of about 13 years, while we tripled our drug rebate collection by redesigning it from a mainframe system to one that's integrated into our solutions, we more than tripled. We went from $170 million in collections to now we're tracking consistently $600 million in rebate collections, in part through this redesign and also the introduction of drug rebating on HCPCS procedure codes where drugs are administered in other settings like a physician office versus being delivered from a pharmacy. And we are now doing ingredient level drug rebating for compound prescriptions. So with that information submitted to us now through the MMIS, we're breaking down that drug and going to the appropriate manufacturers and getting that rebate from those manufacturers that have ingredients into that compound prescription. The Medicare disproportionate share hospital adjustments, very, very important, critical to supporting our hospitals in New York State. Chapter 621 eligibility, that was a project where it was for people that had been institutionalized for 5 years because of mental health or developmental disability. They enter out into the community, and the counties, which traditionally pay 25% of their Medicaid services, the state assumes that responsibility. It was a broken system. The counties were left with there were lawsuits filed against the state over this. We worked diligently with the counties and our sister agencies and ended up saving over $100 million, putting that back into the hands of the counties without them having to engage a consultant that wanted to take a 10% tip on all the savings they purportedly were going to achieve. So they went silently into the night. The counties are very pleased. We have a well-defined process going on for that now also. The Medicaid Fraud Control Unit also, we support them with our systems. Some other initiatives in New York State are the managed long-term care that's going on and the work towards the dual eligible, the capitation of dual eligibles. Here are some statistics for a key agency of users, our Office of Medicaid Inspector General. We have 275, probably closer to 300 now users, 1,700 queries each and every week, $880 million recovered just in calendar year 2013. I think that's a national record. Some value-added differentiators, which you can look at your leisure once the presentation is posted. I think I've touched on many of these. And our corporate overview. We have a booth over in the exhibitor area. We welcome you to stop by and meet our colleagues. Ken Romansky is here, our Executive Vice President. He's been with the company for 30 years, has implemented dozens of large-scale health and human service solutions. And Dan Balin, who spent 15 years with the New York State MMIS contractor and was project manager for the MDW implementation. We didn't kill each other during that period of time, so we decided to work together. And I think that's all about. Do we have time for questions? All righty. We will be at the booth if you have any follow-up questions. Thank you very much for your time and attention.